Hey everyone, and welcome. So today we're going to tackle a topic that affects so many people but is often, really misunderstood. We're talking about alopecia, which is just the medical term for hair loss. In this explainer, we're going to break down what it is, what causes it, and what you can do about it, all in a really clear, straightforward way. Ready? Let's dive in. So let's just start here. Are you worried about hair loss? I mean, it's a question that can cause a ton of anxiety, right? Maybe you've been noticing a little more hair in your brush lately, or maybe in the shower drain. It's a super common concern, and you know what? It is completely valid to feel worried when you see changes you don't quite understand. Okay, but before we jump in too deep, let's just put things into perspective with this number, 100. So, what's that about? Well, believe it or not, it is perfectly normal to lose around 100 hairs every single day. Most of the time, we don't even notice it's happening because new hairs are always growing in to replace them. So, yeah, a little bit of daily shedding, that's just part of the natural cycle. So let's get crystal clear on what we're actually talking about here. Alopecia, it's just the official medical term for hair loss. And it's really important to know that this isn't just about the hair on your head. It can affect your face, your body, pretty much anywhere. All right, so now that we've got the basic definition down, let's get a little more specific. Because alopecia isn't just one single thing. Nope, it's actually a broad term that covers several different conditions. We're going to look at some of the most common types you might come across. Okay, so here are the main players on the field. First up, you've got male and female pattern hair loss. A lot of people are probably familiar with those. Then there's something called alopecia areata, which is actually an autoimmune condition. And finally, we have telogen effluvium, which sounds complicated, but it's basically a type of temporary hair thinning. Don't worry, we're going to break each of these down. So now that we kind of know what alopecia is, the next big question is, why? Why does hair loss happen? Getting to the bottom of the cause is really the first big step toward figuring out how to manage it. And trust me, the reasons for hair loss are just as varied as the types themselves. Let's look at two of the most common causes, which are actually totally different from each other. For pattern hair loss, think of it as being kind of pre-programmed in your genetics. It's in your DNA, and it causes your hair follicles to get way more sensitive to certain hormones. But for alopecia areata, that's a whole different ballgame. The cause is internal. It's basically your own immune system getting its wires crossed and mistakenly attacking your healthy hair follicles. And then there's this one, telogen effluvium. The key phrase to remember here is shock to your body. This isn't about your genes or a long-term autoimmune issue. It's a temporary reaction to some kind of major event that messes with your hair's normal growth cycle. It basically pushes more hair than usual into the shedding phase, and it all seems to fall out at once for a little while. So what kind of shock are we talking about here? Well, this list gives you some really clear examples. It could be something psychological, like a period of intense stress or grief. Or it could be a physical trigger, like childbirth, a big surgery, or even a sudden drop in something like iron or zinc. And here's the tricky part. The hair loss often shows up a few months after the event, which can make it really hard to connect the dots sometimes. And of course, it doesn't stop there. Other things can play a role too. I'm talking about certain medications, skin infections, and even just physical stress on the hair itself, like from wearing super tight hairstyles all the time. That actually has its own name, traction alopecia. Even harsh hair treatments can contribute. Okay, so with all these different causes, you can probably see why trying to self-diagnose can get, well, a little tricky. So if you're concerned, what's the next step? This part is all about how you can get some real clarity and a proper diagnosis from a professional. The good news is, the path to getting a diagnosis is actually pretty straightforward. It all starts with just having a chat with your doctor. You tell them your symptoms, your concerns, and then they'll do a physical exam, taking a close look at your hair and scalp. Sometimes they might suggest a few extra tests, like a blood test or maybe taking a tiny skin sample, just to rule out other things and nail down the exact cause. Right, so once you have a diagnosis, the next logical question is, okay, so what can we do about it? Let's explore the different ways to treat and manage hair loss. And it's super important to remember that the right option for you really depends on what's causing it in the first place. The goals for treatment can be really different depending on the type of hair loss. With pattern hair loss, the main idea is to slow the whole process down and hopefully help some hair regrow. For alopecia areata, that autoimmune condition, the goal is to calm things down and help the hair grow back. But with telogen effluvium, it's a completely different story. The focus there is on dealing with whatever that underlying trigger was, and then usually the hair loss just stops all on its own. Okay, let's get into some of the specifics. For pattern hair loss, there are some really well-established medical treatments. For both men and women, a topical scalp application called minoxidil is a super common option. Men might also be prescribed tablets called finasteride, while women could be prescribed anti-androgen tablets. But here's the absolute most important takeaway. You always have to talk to your doctor, especially because some of these treatments are not safe at all if you're pregnant. Now, for alopecia areata, the treatments are all about trying to calm down that immune system attack on the hair follicles. This could mean things like steroid creams or injections, special topical medicines you get from a specialist, or even UV light therapy. In really severe cases, a doctor might prescribe medicines that suppress the entire immune system. But it's also worth saying, for just a few small patches, some people choose not to do any treatment at all and just wait and see if it regrows on its own. So treatment is definitely one part of the picture. But, living with hair loss involves so much more than that. This condition can have a huge emotional impact. So let's take a minute to talk about support and self-care, because they're just as important. I really want to pause on this for a second because it's just so, so important. The experience of losing your hair, it can be incredibly upsetting. It can really knock your self-esteem and affect your mental health. So if this is something you're going through, please take this message to heart. You are absolutely not alone in this. So what can actually help you cope? Well, there are a ton of different strategies, both practical and emotional. Some people find a real sense of confidence and comfort in wearing wigs, scarves, or hats. For others, taking control and shaving their head feels incredibly empowering. And so critically, reaching out for emotional support, whether it's through counseling or joining a group with people who just get it, can make a world of difference. And here's a really simple but super important piece of practical advice. Your hair provides natural protection from the sun. So if your scalp is more exposed because of hair loss, it is absolutely crucial to protect that skin from sun damage. So wear a hat, wear a scarf, whatever you need to do when you're outside. We really can't overstate the connection between our physical health and our mental well-being. It turns out people experiencing hair loss can be at a higher risk for things like anxiety and depression. So if you're finding it really difficult to cope, please know that it is a sign of incredible strength to reach out and talk with a doctor or a mental health professional. Help is there. And the great thing is, you don't have to figure out where to go all on your own. Here are a couple of excellent resources to get you started. Organizations like the Australia Alopecia Areata Foundation offer specialized info and support groups. And for broader mental health support, services like Beyond Blue are there to help anytime you need them. And that brings us to our final thought for today. We've talked about the science, the treatments, and how to cope on a personal level. But this asks us to look a little bigger, at our role as a community. How can we all help create a more understanding, more supportive world for people with hair loss and really any other visible difference? It's a powerful question to end on. Thank you so much for joining me for this explainer.